Hey guys, this is Dr. Gonzalez. How's it going? Today we're going to talk about the following topics, and let's just go ahead and get started. In the neck, we also have something that we call the cervical plexus, which is formed by the ventral rami of C1 to C4 spinal nerves. So here on the screen, for example, we see spinal nerve number 1, ventral ramus. This is spinal nerve number 2, ventral ramus. This is C3, ventral ramus. And this is C4, ventral ramus. Now, C1 to C4 ventral ramis are connected by nerve loops located anterior to the origins of the levator scapula and the scalenus medius, and deep to the sternocleidomastoid. Some of the branches include cutaneous branches such as the lesser occipital, greater auricular, transverse cervical, and supraclavicular nerves. Another nerve we're going to find coming from the cervical plexus is the phrenic nerve, which comes from C3 to C5. And this one descends anterior to the scalenus anterior muscle, which is crossed anteriorly by the transverse cervical and suprascapular arteries at the root of the neck. And it passes anterior to the first part of the subclavian artery, over here, and it descends through the superior and middle mediastina to reach the diaphragm. Another branch we see coming from cervical plexus is going to be ansa cervicalis, which you can see here labeled in blue. You're going to have an inferior branch and a superior branch. Another structure we're going to see in the neck is the thyroid gland. This is an endocrine gland that secretes 3 hormones. Specifically here, we're going to have the secretion of thyroxine or T4 and T3, which stimulates the metabolic rate. And it also secretes calcitonin, which would be the 3rd type of hormone, which lowers the blood calcium levels. This gland is surrounded by a connective tissue sheath, which is derived from the pretracheal layers. Here's your trachea, and the larynx. Here's the larynx. This gland can move up and down when there is some type of swallowing situation. The parts of the thyroid gland includes, there's going to be 2 lobes, a right and left, an isthmus, which is here, and a pyramidal lobe, which is not always present, but we could see it when there's anatomical variations. These lobes are roughly pear-shaped, and the apex is going to be directed upward, as you can see right here. And it reaches the oblique line of the thyroid cartilage. This is the thyroid cartilage. And the base directed downward, which reaches the 4th or 5th tracheal cartilages. The isthmus extends across the midline anterior to the 2nd and 3rd tracheal cartilages, and the pyramidal lobes of the thyroid project upward from the isthmus, usually just to the left of the midline. Now, some of the anatomical relations of the thyroid gland include anteriorly, we're going to see the sternothyroid muscle, the sternohyoid, and posteriorly, the 2nd and 3rd tracheal cartilages. Some of the arteries we're going to see supplying the thyroid artery is the superior thyroid artery. And here we can see some of those arteries specifically. This one is the superior thyroid, which is a branch of the external carotid. This is the external carotid right here. There's also an inferior thyroid artery, which is a branch of the thyrocervical trunk, which is this structure right here, which comes from the first part of the subclavian artery. As for the veins, we have the superior and middle thyroid veins. This is the inferior vein. This is the superior thyroid vein. And this is the middle thyroid vein. The inferior thyroid veins descend anterior to the trachea and posterior to the manubrium of the sternum, and they are going to drain into the corresponding brachiocephalic vein. Sometimes right and left inferior thyroid veins can join to form a single trunk, which drains into the left brachiocephalic vein. Other glands we're going to find in the area of the neck, it's the parathyroid glands. These are usually 4 in number, 2 superior and 2 inferior, 2 on the right and 2 on the left. These are going to be flattened oval bodies located on the posterior aspect of the lobes of the thyroid gland, which is this structure right here, under its facial sheath. The superior glands will lie approximately at the level of the lower border of the cricoid cartilage, and the inferior glands will lie near the inferior pole of the lobes of the thyroid gland. Sometimes they can be found also below the level of the thyroid gland, even in the superior mediastinum close to the thymus. They will secrete parathyroid hormone, which helps to increase the blood calcium levels. The arterial supply for these glands is the superior and inferior thyroid arteries, and the veins, it's the parathyroid veins that drain into the thyroid venous plexus. In the neck, we also have lymphatic drainage that's gonna help the head and neck to drain pathogens that could enter from the extremities or from ingested food. So these lymph nodes of the head and neck are arranged in several regional groups and one terminal group. The terminal group receives all lymph of the head and neck directly or indirectly. So let's go over some regional group lymphatic nodes. First off, we have the occipital lymph nodes. These are located over the occipital bone at the apex of the posterior triangle of the neck, and they receive lymph from the posterior scalp and the upper neck. We also have mastoid nodes or retroauricular nodes. These are the ones you can see in blue, and these are located over the lateral surface of the mastoid process posterior to the auricle, which is this structure right here. They receive lymph from the scalp above the auricle and the external acoustic meatus and the actual auricle. We also have parotid nodes or preauricular nodes. Specifically, we have these that are superficial, and we also have some that are deep. But in general, these parotid nodes are located on or within the parotid gland, and they receive lymph from the scalp above the parotid gland, external acoustic meatus, the auricle, the middle ear, and the lateral part of the eyelids and the parotid gland itself. We also have a group of scattered lymphatic nodes that we know as the facial nodes. Here we can see this nasolabial node, this buccinator node, and we also have these mandibular nodes. These, like I said, they are scattered along the course of the facial artery and vein, and they receive lymph from the eyelids, nose, face, cheeks, and the lips. We also have submental nodes. These are located in the submental triangle. They receive lymph from the tip of the tongue, anterior part of the floor of the mouth, the mandibular incisor teeth, and are associated also with the gingiva and a central part of the lower lip and chin. There's also submandibular nodes. These are located in the submandibular triangle in relation to the submandibular gland, and they receive lymph from the submental and facial nodes and are directly from the anterior scalp, the nose, nasal cavity, paranasal sinuses, the palate, the face, cheeks, lips, teeth, and other associated gingiva. We also have some anterior cervical nodes. These are located along the course of the anterior jugular vein in the lower part of the neck, and they receive lymph from the skin and superficial tissues of the front of the neck. There's also some superficial cervical nodes. These lie along the course of the external jugular vein, and they receive lymph from the skin over the lower part of the parotid gland, the angle of the mandible, and the lobule of the auricle. If you notice over here, we have some very deep lymph nodes that we know as the retropharyngeal lymph nodes. These are located in the upper part of the retropharyngeal space, and they receive lymph from the nasal cavity, paranasal sinuses, the palate, the middle ear, the auditory tube, and the upper pharynx. We also have some additional nodes associated with the cervical viscera, for example, the pretracheal and the thyroid lymph nodes. These are going to receive lymph from the larynx, the trachea, the lower pharynx, the esophagus even, and the thyroid gland. And there are also some lymph nodes in the posterior triangle of the neck along the course of the accessory nerve and the transverse cervical vessels. The ones we're looking at right now, these are known as the superior deep lateral cervical lymph nodes or internal jugular lymph nodes. It's part of the deep cervical nodes. In general, this is a terminal group because they form a chain along the course of the internal jugular vein and they are embedded in the connective tissue of the carotid sheath. They are divided into superior and inferior subgroups. Here we're observing the superior group. In the root of the neck, they give rise to the right and left jugular lymph trunks. The left jugular lymph trunk is going to drain into the thoracic duct. Alternatively, the jugular lymph trunks may also drain into the confluence of the corresponding internal jugular and subclavian veins. We also have some nodes that are called the jugulo-digastric nodes, like this one you're observing right here. This is a very deep cervical node located posterior and inferior to the angle of the mandible. So you can see that's the mandible. And it's close to where the posterior belly of the digastric muscle crosses the internal jugular vein. It is mainly concerned with the lymph drainage of the tongue and the palatine tonsils. More inferiorly, we have the jugulo-omohyoid node. This one is deep. It's a deep cervical node located close to the intermediate tendon of the omohyoid muscle. We also have some nodes that are known as the supraclavicular nodes. These are referred to by clinicians as the sentinel lymph nodes or Virchow nodes because their enlargement can alert physicians to the possibility of malignancies in the thoracic and or abdominal organs. And don't forget to click on this video if you want to learn more about the information that we're discussing today. And that is it for today. Thank you for watching and I'll see you in the next one. Bye.